Two new studies show that once again, this show was right about natural immunity from infection, and Fauci was wrong. The New York Times saying that both reports looked at people who had been exposed to COVID a year earlier. Cells that retain a memory of the virus persist in the bone marrow and may churn out antibodies whenever needed. The other study found that memory B cells continue to mature and strengthen for at least 12 months after the initial infection. Here now is Dr. Harvey Risch, professor of Yale School of Public Health, and Dr. Peter McCullough, cardiologist, internist, and epidemiologist. Dr. Risch, those two studies still make the case that people who have had COVID should get vaccinated. So are they ignoring their own findings?
I don't understand why they would make that case. We have empirical information from huge studies, from a study in Israel with 4.6 million people that showed that people who had had COVID in the past have as much reduced risk of getting it again as people who are vaccinated. 90% or better reduced risk from having had COVID, protection against infection, protection against being hospitalized, and protection against mortality. It's just the same. And in fact, you have people like Dr. Martin Makary at Johns Hopkins today saying that 150 million Americans have immunity and don't believe the CDC that immunity is real and it works. And the evidence is that's right.
So it's like a natural vaccination process. In other words, Dr. McCullough, your thoughts?
Well, it certainly is. And the individuals who have had COVID-19, the data show, and I looked at the papers very carefully as an author and editor and practicing doctor. One paper published recently went as far as doing bone marrow biopsies in patients who have had COVID-19. And even after the antibodies are long gone, the plasma cells are there, and they are ready to produce antibodies if indeed the body is exposed to COVID-19. Now, Americans should know that the current vaccination program is not even recording if a patient has had prior COVID-19 at the vaccination centers, and the vaccine adverse event reporting system has no checkbox in the report to account for whether or not someone has actually had COVID-19. And so we have ample evidence now that patients with COVID-19 should not receive the vaccine, is contraindicated, and the CDC has no capture of this.
Well, they have no credibility, I'm sorry. In the original SARS, I think the immunity lasted up to 17 years. And it seems to be tracking on that level. But there's another new study on masks, and guess what it found? Mask mandates in use are not associated with slower state-level COVID-19 spread during COVID-19 growth surges. Dr. Risch, now this matches other studies we've been highlighting for over a year, one regarding influenza, another Paris Island recruits observational study. Thoughts on this?
So that's correct. Also, the Danish study that also showed that masking doesn't really prevent the wholesale restriction of the virus, that it still spreads even in spite of the masking to other people. And, you know, we'd like to be in control of our destiny and be able to wear masks and prevent ourselves and others from getting infected. It's just that the masks don't work all that well for that.
And yet we still have the American Academy of Pediatricians, or Pediatrics, Dr. McCullough, with this obscene recommendation that children, little toddlers, still be wearing masks when they go to school in the fall. And the New Jersey Governor Phil Murphy is saying what he expects when school starts. Watch this.
We're trying to predict what school looks like on September 5th. My guess is we're likely to be masked for the simple reason that we only a couple of weeks ago have been able to get 12 to 15-year-olds vaccinated.
Dr. McCullough, again, 2 to 11-year-olds in masks, unreal.
Yeah, it's simply not supportable, and I think it's going to do more harm than good. America really has to move on. The masks have really come to symbolize something other than the infection. You know, I think, 6 months ago we were in the heat of the infection. The problem was the virus. Now it's almost like a mental contagion, almost a neurosis, focusing on masks.
No. Dr. Risch, on kids in the masks.
Yes, I agree. Look at other jurisdictions. Look at Sweden. Look at states that have opened, that have had kids in school that are not masking, that are not separating, that take down their plastic, clear plastic sheets between kids and so on. The teachers aren't getting sick from the kids. The kids aren't getting sick and so on.
It's sheer insanity and control freaks. Gentlemen, thank you.